Today, in this time, we are going to talk about hypoglycemia. First, we should know that this is a condition that occurs when your blood sugar, glucose, is too low. Then we have glucose levels. Normal level of blood glucose is generally accepted between 70 and 120 mg per deciliter. And something that is really important for us to know is that symptoms are usually going to appear when blood glucose drops below 50 mg per deciliter. The most common forms of hypoglycemia occur as a complication of treatment of diabetes mellitus with insulin or oral medications. Hypoglycemia is less common in non-diabetic persons, but can occur at any age. Now, we're going to talk about causes of hypoglycemia, and for that, we're about to watch a video that is going to show us the different causes of hypoglycemia.
Hypoglycemia may be overdose of medicines for diabetic control, too much of insulin through injection, accidental or during change in insulin doses or types, delay in taking food, unusual exercise or stress, working during night without intermittent feeds, excessive use of alcohol or other sugar-lowering drugs or food items.
Other causes of hypoglycemia are hyperinsulinemia, inborn error of metabolism, medications and poisons, hormone deficiencies, prolonged starvation, alterations of metabolism associated with infection and organ failure. Then we have that the symptoms include.
The symptoms may include excessive tiredness, sweating, dimness of vision, confusion, dizziness, hunger, headache, trembling, racing pulse.
Those are not the only symptoms. Also, we have neuroglycopenic manifestations. First, we have abnormal mentation, impaired judgment, non-specific dysphoria, daydreaming, exaggerated concerns, negativism and irritability, personality change, confusion and amnesia, automatic behavior, also known as automatism, ataxia focal or general motor deficit, paresthesia, headache, stupor, coma, abnormal breathing, generalized or focal seizures, memory loss, and amnesia. Now we have treatment. First, we should note that this depends on the patient's status. If the patient is awake, we can give him or her oral glucose intake, but if the patient is unconscious, we have to give him IV 50% of its dose. Now we're going to watch a video that is going to give us a few recommendations.
Drink a small glass of any fruit juice or even a regular soda. Drink a larger glass of milk. Suck on 5 or 6 pieces of hard candy or caramels. Take 1 tablespoon of sugar or honey, or if you're out and about, you can take 3 or 4 glucose tablets. You can get these at the drugstore. So you want to recheck your blood sugar every 15 minutes to make sure it's above 70. And if it's not, if it's below 70 and you're still not feeling right, repeat any one of those quick fix steps.
And what about prevention? First, we should note that the risk of further episodes of diabetic hypoglycemia can often, but not always, be reduced by lowering the dose of insulin or other medications. Many of the inborn errors of metabolism require avoidance or shortening of fasting intervals or extra carbohydrates. Several treatments are used for hyperinsulinemic hypoglycemia, depending on the exact form of severity. Some forms of congenital hyperinsulinism respond to diazoxide or orthoxide. Also, it's really important.
Okay, hypoglycemia or low blood sugar can make me feel really nervous or tired. It's caused when I skip meals or snacks or if I've been more active than usual. I really need to make sure I check my sugars when I feel this way. If they're under 70, I need to make sure I get something really sugary and sweet to eat or drink until it's over 70. And I want to make sure I record all that in my logbook. I want to make sure I bring my logbook to every doctor's visit and make sure I take my medicines as prescribed.
Absolutely, you got it. Now there's one last thing. If you have an episode of hypoglycemia that is so severe that you need the assistance or help of your wife or a coworker to give you something to bring your blood sugar up, you need to call me immediately because that's very serious and I may need to adjust your medications right away.
Well, absolutely, I will do that.
Great.
Finally, we have something called acarbose. One situation where starch may be less effective than glucose or sucrose is when a person is taking acarbose. Since acarbose and other alpha-glucosidase inhibitors prevents starch and other sugars from being broken down into monosaccharides that can be absorbed by the body. Patients taking this medication should consume monosaccharide-containing food such as glucose tablets, honey, or juice to reverse hypoglycemia. Thank you for your attention.